Right, it's 1 o'clock, guys. Can everybody hear me okay? Can everyone hear me okay? So if you guys just unmute your mic.
Yes.
Yes. Can you hear me?
Yeah.
Perfect. All right, okay, let's get this started.
Yep.
Okay, perfect. So it's 1 o'clock. I'm just going to give 1 more minute for people who are having their last minute lunches, or if they want to grab some water or a tea, coffee, some biscuits, and then we'll start. So as you guys can see on my first slide, it just basically gives you guys information about, make sure you guys check your audios, use headphones during the discussion if possible, turn off your microphones during the webinar, make sure your webcam is off for a better experience. But if you do want your webcam on, I would love to see everybody. And if you guys have got any questions, you can put it in our chat box. We've got 2 moderators and they will be answering the questions.
Hi.
Hi, can you hear me?
Yes.
Awesome, good, very good. Right, so we're gonna start. My name is Saba. Let me just check one more thing, sorry. That's it, perfect. Okay, so my name is Saba. I'm here from Smart Dental Compliance and Training. I'm one of the senior compliance consultant at Smart Dental. Smart Dental is all about providing practices with a all-in-one compliance solution, which has compliance, CPD courses, HR management, and stock management. Now, a lot of you are our clients who are currently using the system. Some of you are not using the system, so you're brand new. So if I do refer to AIOM at any point or Smart Compliance Software, it's just our compliance system that our members use, okay? So today we'll be doing a webinar on the new national NHS cleaning standards. The deadline for these cleaning standards is 4th of November. In terms of what they are, what you guys need to do in order to become compliant, what are the requirements, this is what I will be covering in our webinar today. The webinar is approximately an hour, so I will be talking for the next 30 to 40 minutes. And then after that, you guys can ask questions, you can put it in your chat box, and I'll try to go through all the questions and answer them, okay? So I know there's a massive confusion about the new national NHS cleaning standards and what you're supposed to be doing in order to become compliant, who's supposed to be doing it, when's the deadline, what needs to be done, how often it needs to be done. So these are all the things that I will be covering at the webinar today. We're going to start off with a quick aim. So the aim of the webinar is to look at the cleaning standards covering all the cleaning tasks throughout the NHS, regardless of which department is responsible for this. This includes dentistry. So the National Standard of Cleanliness is only relevant to NHS practices. It's not for private practices, okay? So at the moment, private practices do not need to abide by the National Standard of Cleanliness. However, I would highly recommend, even if you are a private practice, to start or have knowledge of the standards, because a lot of the time what starts off with NHS, it very quickly moves to private practices as well. So it's always good to have understanding and knowledge of what you are supposed to be doing in order to be compliant, okay? In terms of the objectives for today's webinar, we're going to be looking at or understanding what the guidance is, what templates you guys need to have or what templates you need to be filling out, create an element list, record in a practice policy, outline cleaning responsibilities between the staff members or the cleaning team, define cleaning frequencies, categorize functional risk areas, establish your cleaning commitment to cleanliness charter, star rating scores, and technical audit process. So these are some of the things that we will be covering in today's webinar. So what my aim for today's webinar is going to be, I've had so many messages from our current clients and so many messages from people on Facebook saying, I'm really confused what I'm supposed to be doing. So I thought, let me create a very simple term webinar for everyone out there So I'm going to try to break everything down very, very easily for you guys, so you can just get on with it and you understand what you're supposed to be doing in order to be compliant. Okay, but if you still have any questions, please feel free to ask me. Otherwise, I would make sure that it's very easy for everyone to understand. So the first thing we need to understand are what are the standards of the National Cleanliness. Okay, so there's 5 standards altogether. Standard number 1. So imagine there's 5 tasks that you need to do, okay, in order to be compliant with the National Standard of Cleanliness. So 5 tasks, 5 standards, easy way to remember. Task number 1 or standard number 1, you need to have a cleaning specification in place, okay? And then what I will do is I will cover within the webinar what a cleaning specification is. Standard number 2, or let's say task number 2, you need to have commitment to cleanliness charters. These are posters which need to be displayed in the functional risk areas. So I know you're thinking, oh my God, what is functional risk areas? But don't worry, I'm going to cover that within the webinar as well. Number 3, or standard number 3, is you need to have a technical audit in place. A technical audit is an audit that you would do in-house, okay? And again, we've got the audit template for that, so you don't need to worry about it, okay? And then we've got standard number 4 and standard number 5. These are 2 additional audits that you would be required to do. One of them is an external one, and one of them is an in-house one. The last 2 audits, which is standard number 4 and standard number 5, they haven't come into place as yet. So you don't need to worry about them. There will be more updates about those audits coming up, okay? So what we're going to do in today's webinar is we're going to look at standard number 1, standard number 2, and standard number 3. These are the 3 standards we're going to be looking at and concentrating on. So let's start off with standard number 1. As I said, standard number 1 is having a cleaning specification in place. A cleaning specification is basically cleaning responsibilities. It's a local schedule of cleaning responsibilities detailing all items or all areas which need to be cleaned, who is responsible for cleaning each one. This must allow enough time to complete specific training tasks and training to do regardless of the team members assigned to the task, okay? So your cleaning specification should state 3 things. What you're supposed to be cleaning. So if it's a dental surgery, is it the dental surfaces, the floors, the dental chair, the sinks, the units? So you need to break it down and provide explanation of all the areas that you would be cleaning, how frequent you would be cleaning them. So for example, if it's a dental surgery, how frequent would you be cleaning the dental surgery? How frequent you would be cleaning those areas, okay? And last but not least, who would be cleaning those areas? Is it going to be the nurse? Is it going to be the cleaner? Is it going to be someone specific that you've allocated to perform that cleaning? Okay. So that's just standard number 1, your cleaning schedule. And if you are our AIOM member, we have created a National Standard Cleanliness folder under the compliance templates, and it does clearly have all these templates on them. So you don't actually have to do anything because we've done the whole legwork for you. It's taken us months, weeks, days, nights. We've put a lot of time and effort into compiling all these documents. And it's been very difficult because every time there's a new guideline that comes out from NHS, they forget about dentistry, okay? They solely concentrate on GP or hospitals or private clinics. And when it comes to dentistry, you kind of have to figure it out. You have to look at what are the similar areas, all right? So that's why we've done an extensive research behind the whole National Standard of Cleanliness. We've spoken to the CQC, we've spoken to NHS inspectors to create all the templates for you. So you don't have to create them, you don't have to worry about them, okay? So that's standard number 1, which was the cleanliness schedule. The next thing I'm going to talk about is, and everybody keeps on asking me, is what is functional risk categories or what is functional risk areas? Functional risk category is reviewing each area and allocating them with a functional risk category. Different areas are used for different activities. So for example, a surgery is used for seeing patients and treating patients. Hence, they have different functions and different risks. So because there's a lot of things going on in a surgery, there's a high chance of cross-contamination, it will have a different function and a different function risk category, okay? The different functions and risk will impact on cleaning methods. So depending on what area has what function risk category, whether it's FR1, FR2, FR3, or FR4 or FR5, you would have cleaning methods for that area, the frequency of cleaning that you are doing. Is it weekly? Is it daily? Is it monthly? Is it quarterly? And the method of monitoring. So what audit are you doing in order to make sure that those areas are being cleaned properly? Okay, so I've put an example here. For example, a surgery may require a higher level of cleaning than a storeroom or an office area. Okay, there are 6 functional categories outlined in the National Standard of Cleanliness. So within the National Standard of Cleanliness, there are 6 functional categories. So FR1, FR2, FR3, FR4, FR5, and FR6, okay? In the next slide or during the webinar, we would be looking at which one are relevant to dental practices. So standard number 1, which I've already gone through, I'm going to come back to this one later on. Functional risk categories. So on this diagram, which is taken from the actual standards that which NHS has provided us, it tells us the functional risk category and suggested functional areas, okay? So this is what has been suggested. So what we need to do is, or what we have done for you, is we have matched what areas within a dental practice is relevant to which functional risk category. So for example, it says functional risk category 1, you've got intensive care unit, operating theatres, chemotherapy, delivery units, pharmacy. So these are all the areas, but as I said, they're all related to either hospital or private clinics. Then you've got the functional risk category 2, where you've got the acute or community wards, dementia wards, treatment room, where invasive procedures take place, endoscopy units, cardiology. So these are, again, all related to hospitals, okay? Or X-ray units where X-rays are being taken. Then you've got the functional risk category 3, which is mental health and learning disability wards, urgent care units, dental outpatient departments. So a lot of practices are getting confused because they think, oh, this must be the dental surgery because it says dental outpatient department. But this is referring to hospital, okay? It's not referring to a dental practice. It's referring to a hospital which has a dental outpatient department. Then we've got the functional risk category 4, where we look at treatment room with invasive procedures do not take place. Then we've got laboratories, pharmacies, occupational health. Then we've got the functional risk category 5 and 6, okay? The 6th one talks about the administration office, medical records, whereas the 5 talks about main reception areas, like corridors as well. These are all covered in FR5, okay? So that's an overall what the NHS guideline says. However, what we have done is we have broken it down for you. So I've created a very easy table over here, and I've put down the functional risk category, so FR, which are relevant to dental practices. I've put down the area, the audit frequency, so how often you need to carry out these audits, and what should be your target score, okay? So we are going to talk about audit frequency and target score as well in more details, but let's have a look at the functional risk category and the areas first. So for example, FR2, this is referring to surgeries and the decontamination area. So that's your dental surgeries or dental treatment rooms where treatment is taking place, and the decontamination area where you're carrying out the decontamination. Now, if your decontamination area is within the surgery still, then that covers, it's all covered as part of FR2. If it's a separate dedicated decontamination area, it's FR2, okay? The next one is FR4. FR4 is for entrance, corridors, and waiting areas. So if you've got a separate waiting area, then a reception area, that is FR2, okay? FR4, sorry. And the entrance area and all your corridors as well, these are FR4. The next one is FR5. Now this one's a bit confusing because some practices have the reception and waiting area merged together. What we mean by FR5 reception area is literally where your desk is and everything around your desk, that area, okay? The waiting area would be the area that's opposite the desk, okay? Or maybe behind the desk, or maybe somewhere different, or maybe in an isolated room. So FR4 refers to the reception area where you are based or allocated. And then the last one is FR6. FR6 could be an office, it could be a non-treatment room, a TCO room, a storeroom, a staff room. This is FR6, okay? So everybody clear on the areas and what functional risk category. Now, I know some people are going to say, oh, but I heard this webinar and they said FR3 is surgeries and they said FR4 is something else, FR5. According to what we've spoken to the NHS team and the CQC and looked at the National Standard of Cleanliness guidelines, this is the whole gist of it, all right? And I've actually been at an inspection a couple of weeks ago where we did discuss the functional risk categories and the CQC were happy with that, all right? So if you do think it's not correct or if it's different, that's totally up to you. Or if somebody else has advised you total different information, again, it's up to you if you want to follow them. But according to all our research, where we've spent days and nights and, you know, talking to people, talking to inspectors, this is the information that we've come up with, okay? So now that you understand what are the areas and what is the function list category, the next thing you need to do is audit it, okay? How often do you audit? So with the FR2, you're auditing it on a monthly basis because it's a higher risk level area. With FR4, you're doing it on a quarterly basis. With FR5, you're doing it on a 6 monthly basis. And with FR6, you're doing it on an annual basis, okay? So next thing was audit frequency, which I've covered with you guys. The last one is the target score. So when you carry out your audit, you would be auditing each of these areas according to what you are cleaning or what the cleaning specification highlights. And then you would be scoring. So for your FR2, you should have a minimum score of, or your target score should be 95%. For FR4, it should be 85%. For FR5, it should be 80%. And for FR6, it should be 75%. Okay, I know lots of numbers, lots of new information, so don't worry. We will be uploading these slides onto the AIOM software so you can refer back to them. Okay, so now that we fully understand what are the functional risk categories, what are the areas, is the audit frequency, what is the target area, let's move on. Okay, let's move on. So we've got the star rating posters. So I know you guys have been listening, oh, you need to display this, you need to display that. Once you have audited or carried out your audit, the one that I've talked about over here, and you've got your target score, you can do the star rating posters. So according to what you are scoring or what your target score is, you for each area or for each functional list category, you would have a poster. It is recommended that the star rating poster are displayed in area which is visible to patients and close to the commitment of cleanliness charter. Okay, it might be impractical to display star rating in some areas. The local decision of where to place these star rating posters should be documented within your infection control policy. Now, this is a very good point. If you're not displaying your star rating posters, or if you are planning to display them, you need to make sure you customize your infection control policy. So those of you who are our AIOM members, on our platform, on our software, every single policy has a practice-specific protocol box. And within that box, you can add your own practice-specific protocols. So you will be able to edit and add where you would like to display these posters. So you can add that as part of your policy. So when you get a CQC inspection and they go through your infection control policy, they can clearly read all those protocols. During the first 6 months of implementation phase, so the deadline for the National Cleanliness Standard is 4th of November, and the first 6 months will be the implementation stage. You do not need to display the star rating. I know practice owners hate posters everywhere or like signages everywhere within their practice. So again, it does say it's not a mandatory requirement. And according to the CQC Mythbuster 38, so CQC in September last month, we're in October now, updated their infection control or infection prevention Mythbuster, which is number 38. And they said there's no expectation of you displaying the star rating posters. They just want you to be aware of star rating posters, but you don't have to display them. Okay, makes sense? Good. So that's about the star rating. The next thing we're going to look at is the standard 2. The standard 2 talks about the commitment of cleanliness. Now, these are the posters that you definitely need to display. Organizations are required to display the commitment of cleanliness charters in the public facing area. So when we talk about public facing area, we talk about reception area. It could be a waiting area. Anywhere, if you've got a board where you've got all your other policies, you can stick it on there. You should outline commitment to achieve a constantly high standard of cleanliness. These charters are available within the AIOM software for you to download. There are specific charters for each area. So each of the functional risk category that we've talked about has a commitment of charter poster. And we've already created these posters for you, uploaded it on Smart Dental Compliance. All you need to do is download them, laminate them, and stick them on the wall according to their FR risk category or according to where the area is located. So a reception room, an entrance, a waiting area, an office, okay? So this is where the posters will go. So these are the commitment of cleanliness. And again, these posters are available on the AIOM software. So we have done all the work for you. You don't need to create any posters, all right? And these posters are based on the FR risk categories. So we've covered standard 1, we've covered standard 2, and here's an example of the commitment of cleanliness charter. Obviously, this is an NHS one. We've created one for dental practices. So our one is totally different, okay? And it's available for you guys to download. And you can see that it states what category it is and what area it covers. All right. Standard number 3. So standard number 3 is the technical audit that you need to do in-house. These audits are conducted on a regular basis determined by the FR category. This check and score cleanliness, these check and score cleanliness, going into the surgery, checking if something is clean, writing down yes or no, or pass or fail. Audits should be carried out at different times of the day or different days of the week. So that all depends on your audit schedule, okay? So the standard 3 is technical audit. Standard 4 is an annual audit. This is to check the efficiency of cleaning. So you would ensure that the delivery of the cleaning service is accurate and abiding by the methodology, policy, color coding, and suitable materials. So this will be an audit on your cleaners. For example, if you've got an external cleaning company and there's a cleaner who comes out to do all the cleaning, you will carry out an audit. And again, we would upload this on the Smart Dental or the AIOM software where you can use the template and do the audit. However, as I mentioned at the beginning of the webinar, this is not a requirement that you need to do straight away. It will be coming, but again, CQC haven't said when is the deadline for this. Overall, the National Standard of Cleanliness, you have got the 4th of November, but Standard 4 and Standard 5 will be coming in later on during the year. Okay, so maybe like December time or maybe January. They haven't given us a specific date yet. So if I was you, I wouldn't worry too much about these audits. And that's why I'm not going to go through these audits in a lot of details. Cleaning protocols. So everybody needs to be aware, and this needs to be part of your infection control policy. Now, what I will highly recommend, we are creating a new cleaning policy. It was covered as part of our cross-infection policy, but we're creating a totally separate cleaning protocol and policy, okay? So you need to understand what is full clean, what is spot clean, what is check clean, and what is periodic clean, okay? Everybody needs to be aware of this. The next thing, which we are already aware, according to the HCAI guidelines, is the national color coding schemes. So if it's red, blue, green, yellow, so you need to be fully aware of these cleaning coding schemes as well. So you've got the mop and bucket already within your practice. They need to be used in the correct areas. All right. Training. So cleaning is a vital part of an overall infection prevention and control process. which aims to provide a clinically clean and safe environment for delivering patient care. The importance of robust training is paramount. All level of the cleaning team, as well as anybody else undertaking cleaning tasks, should be clear about their roles and responsibilities, and they should continue to do CPD. We will have a CPD for the national NHS cleaning standards, so everybody will be aware of this. And again, it will be on the AIOM system, so you can do the training and get a verified CPD certificate. But training is very important, and that's one of the things that the NHS will be looking at, is if you've got the relevant training in cleaning. All right. So the next part of my webinar is to actually go through how you could use the AIOM software to become compliant with the National Standard of Cleanliness. So on our system, so I'm just going to share my screen properly with you guys because I was just sharing my PowerPoint. So let me do a new share. All right, okay. So if I go over to the Smart Dental, so this is our Smart Dental or the AIOM software. And when you log in under reports, we have got a tab that will say the National Standard of Cleanliness. And under that tab, we have added, according to the functional risk categories, we have added all these audits for you to carry out. So for example, if I do the reception cleanliness audit, it tells me what is the audit carrying out date, or who's it carried out by, what is the date, and then it's got all the things that I need to audit. So the general environment, which is the reception area, okay? So what you would do is you would work your way through this audit, giving the answer, is the area visibly clean? Is it free from clutter? Is there any smell? Again, the reception area is clean, uncluttered. Does it smell fresh? So you would work your way through doing this audit, okay? So I'm just going to show you one, and I'm going to actually show you what it looks like once you've completed it as well. So are the notice board cleans? Is the flooring clean? Is it in a good state of repair? Are the doors and the frames clean? Are they in a good state of repair? External windows are clean. So I know that a lot of other companies are doing different Excel sheets and very complicated methods, but we have made it, seriously guys, we've made it so easy, and we've created these e-formats for you. And once you've done this audit, what it does is it automatically calculates your score, and it tells you what is the correct star rating poster you need. Yeah, literally, we do everything for you. As long as you're filling this audit out, and if it's not applicable, you can just put not applicable as well. So as long as you are filling this audit out and submitting it, it will tell you what your score is, okay? So here's my score, there we go. So I've scored 100%, woohoo. And now what I could do is click the download poster, and it tells you what star rating poster you need to display. How cool is that, right? So we've made it really, really easy for you to carry out all these audits, okay? So for every single functional risk category that we talked about earlier on, so for surgeries, decontamination area, entrance, corridors, waiting area, reception area, and offices, we have got an audit that you could do on the AIOM system. And once you've done the one audit, it will automatically prompt you on the activity calendar. So we've got an activity calendar. Let me show you guys on here. It will prompt you on the activity calendar when the next one is due. So it will tell you if it's due in a month's time or if it's due on a quarterly basis based on our stats or based on this table that we've discussed on here, okay? So you will get automated reminders when the next audit is due, and you will go back to the audit section and complete that digital audit. Okay, so that's what we've done in order to make sure practices are well looked after. The other thing, as I mentioned, is under our compliance template, we've actually dedicated a whole folder called the National Standard of Cleanliness. And within that folder, we've added all the supporting document. And the good thing is we're going to keep on adding documents. Every time there's an update, we're going to keep on adding more documents onto this. So we've added all the posters, the commitment of cleanliness poster according to the FR area as well, the audits, we've added compliance grids, we've actually added the whole guideline on there, which again is super easy. I don't know if you've come across the guideline, but it's literally 3 pages, tells you standard by standard or task by task exactly what you need to do and what audit you need to fill, how often you need to do it. So that's what we try to do. We try to make it very easy for our clients or potential clients who use our system to follow everything through. But as I said, not everybody is perfect. So we are still putting a lot more audits. So where we are at now, we've done audit for reception area, we've done audit for surgery, we've done audit for kitchen, but we are working on an FR4 audit at the moment. So hopefully by next Monday, that will be live and kicking as well as a digital audit on our compliance software. Okay, so I'm going to summarize everything because I know there was a lot of information. So I'm going to summarize it all for you guys. So number one, there's 5 standards that you have to abide by or you have to follow. Standard number 1 is about a cleaning specification. A cleaning specification covers 3 areas. What are the cleaning elements? Cleaning elements is basically a list of all the individual items that you would be cleaning. What is the performance parameters? Performance parameters are expected standards of items, okay? And what would be the cleaning frequency? So how often you would be cleaning those areas. So again, here's an example from NHS guideline, but we've got exactly the same thing on our AIOM system, which is dental tailored. So you've got the elements, you've got recommended cleaning, and who's going to be doing it, okay? So we've created something very, very similar for the dental side as well for you guys. So that's your standard number 1, okay? Then we move back to standard number 2. It's about displaying the commitment of cleanliness charter, okay? So again, commitment of cleanliness charters, let me show what they would look like. They look something like this. You can download them from the AIOM system and display them according to their functional risk category. The third standard is the technical audit, which you will perform again on our all-in-one management system. So we've got them all digitally present on the software that you can carry out, okay? And they will tell you what is the percentage of your score for that functional risk category. You can download the star rating, but remember, you don't have to display the star rating process posters, okay? You don't have to display them, but it just tells you what is the star rating you are working towards, and it will put automated reminders on the calendar for when is the next time you need to carry the technical audit out for that particular area. So that was your standard number 3. Your standard number 4 and 5 are 2 additional audits that you are required to do. Again, this is not something that you need to do. Let me find my slide again for you. Here we go. No, sorry. There we are. So standard number 4 and 5 are 2 additional audits that you are required to do. The 4th audit, so standard number 4 audit, is when you're auditing the cleaners to make sure that they're carrying out their job properly. Again, this will be as a digital format on our compliance system, so you will be able to carry that out. And standard number 5 is an external assurance audit. So maybe like a cleaning company or a qualified person will come out and carry this audit for you. These 2 standards are not clear at the moment, okay? So they will be coming on a bit later on during the year. But the first 3 standards are 3 things that you are required to do by 4th of November. All right. And that brings me to an end to my webinar. So as I mentioned, we do have the AIOM system. We have created all the digital audits for you guys according to the FR risk category, which you can do, get a score, download the posters, okay? We have got all the additional templates that you need in order to be compliant with the National Standard of Cleanliness. The system is very user-friendly, it's digital, it's super easy to use. We do provide a lot of support with it as well. So if you have any questions, you can contact us anytime, 7 days a week. We're usually around. We've got an online chat system as well. And if you guys are still confused what you need to do, you can book a training call with us and we can talk to you on how you can use the digital audit for each functional risk category. There's automation of the audit score, and then we provide you with a star rating as well. All right. And that brings me to an end to my webinar. So I hope I have made it really, really easy, and I've helped everyone to understand what the National Standard of Cleanliness are, what you're supposed to be doing, how you're supposed to be doing it as well. And now what we will do is we will go to any questions. So what I will do, I'll go to the chat box. I think my moderators have been answering all the questions. But let's have a look at some recent questions. Please, can you email me the webinar, as I've missed most of it, and if I can't log in. So in terms of the webinar for today, it is recorded and it will be available for everyone to see. So don't worry about it at all. You can access the webinar. Kitchens, FR6, I would guess changing room FR6. Toilets, FR4, right. A lot of people have asked me about toilets. There is nothing in the National Standard of Cleanliness. I know you guys are going to think this is so bizarre because toilets are one of the most, highly infectious areas, but there's nothing in the National Standard of Cleanliness which actually says that you need to audit the toilets yet. Okay, so I'm not going to sit here, I'm going to say it's FR4. I don't want to give you more work if there's nothing in the guideline that clearly states what risk categories toilet fall under. We've checked the hospital guidelines, the GP guidelines, the private clinic guidelines. They have not said anything about toilets. Okay, unless there's, a new requirement or the guideline is amended to cover toilets, I'm not going to say anything. All right, so that's about the toilets. Please, can you let us know which category kitchen, toilets, and changing rooms come under? So as I mentioned, let me go back to my risk category table. These areas, so surgeries, decon room, entrance, corridors, waiting area, reception, office, these are clearly mentioned within the National Standard of Cleanliness, what functional categories they fall under, okay? So I'm 100% sure about these. In terms of the kitchen, toilets, changing rooms or areas, this is not covered yet. We are still waiting for clarification from the NHS guidelines or from the NHS inspectors, which FR category they would like us to add these under. As soon as we have that clarification from the NHS inspectors, we will be able to update the AIOM system and let you know which function risk categories you need to audit for those. CQC says you don't have to display the star rating, but what do the NHS say? So CQC, we need to follow CQC guidelines because we are inspected by CQC. I know you're going to say, well, if we're at NHS practice, we are inspected by NHS as well. But if you don't display the posters, you could say, according to the CQC Mythbuster, these are not mandatory. Also, what the NHS says is during the first 6 months of the implementation stage, you do not need to display the star rating. So even if you haven't displayed it, in the first 6 months, so that's November, December, January, February, March, April, and I'm 100% sure there's going to be more guidelines coming out on 1st of April. So if you haven't displayed anything by 1st of April, it's absolutely fine. You're not going to get scrutinized because it does clearly say about the implementation stage. Okay. Right, we have what does the staff kitchen? Yeah, everyone is concerned, I think, about the staff kitchen areas and certain areas because there's no clarification. As I said, as soon as we get clarification, and we are on to the NHS inspectors day and night trying to get a clarification from them, until we get that clarification, I would say if you start off with the things that you do have clarification for, so which is your surgery, your decontamination area, your entrance, your corridors, you've got clarification for these. If you start off by these areas, and as soon as we do get further clarification, we will let you know, and then you can start auditing your kitchens and the toilet areas. Okay. Do corridors need to have a separate rating? So corridors, entrance, and waiting area all form part of one FR4 category, okay? So when you do the audit on our AIOM system, we do cover corridors, we do cover entrance, and we do cover waiting room in FR4 audit, okay? So you don't need to do like a separate one for each area, it's covered as part of one area. Okay. Any more question, guys? You are more than welcome. We still have got a lot of time. We've still got another 10 minutes. So you are more than welcome to unmute yourself and fire any questions at me if you've got any, if you don't want to type it in the chat box. As I said, this webinar is recorded, so it would be available for anybody using the AIOM or not our current clients. You will be able to download it from our website. We have a consultation room with an option, and we do scan in it too. Would that come under FR4 area? So for your consultation rooms, that would come under areas which are non-abrasive, like there's no abrasive treatment taking place. So that would actually come under FR6. FR4 is entrance and corridors and waiting area. Can you please show where to go to do the audit again? Yes, I could show that. So it would be, I think somebody's just put a screenshot on there as well. So if you go to reports, which is this area over here, there would be a tab. So it is being made live today. So there would be a tab that will say National Standard of Cleanliness on here under the reports. And when you click on it, and then you will be able to do all the audits. Fantastic. Thank you very much for the webinar. Helped understanding it all. That's great, because I know everybody is out there trying to confuse people and trying to make it really, really hard in terms of what you're supposed to be doing. So my main aim was to make sure that I deliver this webinar so even my 4 or 5 years old daughter can understand it. I don't know if she would, but that was my aim, to make it really, really easy for everybody to understand. Thank you. Yeah, I thought it's nice and clear for everyone. Good. That's what we want to do. We want to make people's life easy, because compliance is already a nightmare. So we want to make sure that it is super easy for everyone to follow through. Okay, so that brings us to an end to our webinar. Thank you so much. Guys, if you did enjoy the webinar, I will send you a quick review link. If you can give us a review, that would be great, because we want to continue doing these webinar series next year as well, and the remaining of this year. So by getting your feedback, I can read all this lovely feedback, but by getting your feedback, that'd be great. It can help to improve our webinars as well. And if there's any specific topics you would like us to cover, if you are our client and you would like us to cover any specific topic, then we could do that for you as well. Okay, thank you very much, everyone. I hope you guys have a lovely day. Thank you for all the comments. I can still read them. Fabulous. Thank you, Saba. This is a great presentation. Amazing. That's really, really great to hear. Thank you so much for your time today, especially taking it out during lunchtime. When will be the tab live? The tab will be live by the end of today, so don't worry. It will be live by the end of today. Thank you for your time. I hope you guys have an amazing week. If there's any issues, you know where we are, Smart Dental Compliance and Training. You can give us a call on 0800 689 1061. If you would like some information, or if you would like to book a demo, if you're not our client, I would highly recommend book a demo of the all-in-one management system. It's there to make your life easy. It has compliance, CPD courses, HR management, stock management, everything all under one roof. You can arrange a demo by emailing us, by emailing us or giving us a call. Have a great week, and I look forward to speaking to you all again in the next webinar. Take care, guys. Bye.